To understand addiction, to understand opiate replacement therapy, takes a while. Takes compassion, takes a lack of judgment, of making judgments about the individuals, and it takes being willing to see a bigger picture of an individual in a community and in their own life pattern. It's not about feeling sorry for someone, but it's about realizing that what's happened to them, it's not about what's wrong with them, it's about what's happened to you. Because many of the women who began using opiates and are addicted to them did so because of a painful event or events in childhood. Some of those adverse childhood events could be alcohol in the home, drug abuse in the home, can be incarceration of parents, domestic violence, sexual abuse as a child. So addiction is really more sort of an end game of many of the adverse childhood events. Not always, but often is. And I think it helps to understand that, not to pity people, but really to begin to have a perspective in which you can do work. The work on adverse childhood events has led into work for resiliency and on how do you get back out of that. And it's not like turning a light switch. It's a lifetime work. Addiction to opiates is probably a little bit different than addiction to other things, but it's often associated with addiction to alcohol, often associated with addiction to smoking. Because as we talk about the outcome of pregnancies where there has been an exposure to opiates, particularly replacement therapy, there oftentimes remains the residue of addiction to alcohol and smoking that probably have much more far-reaching consequences as far as the outcome of the baby than do the opiates themselves. So I encourage foster parents, I encourage adoptive parents to understand addiction, to read about it, to get as much exposure to it as possible. To understand replacement therapy is part of the recovery process, and obviously recovery is not a smooth road. Recovery has many potholes of relapses in it, and that's part of recovery. But understanding what the recovery is about, and the medication-assisted recovery, which is what replacement opiate medication fits into, is an important part of that to allow the person who's addicted to stop using and to begin to get their life back together if they can. Not always successful.